Hello, everyone. Thank you for spending this afternoon with me today. So I have been given the task of basically describing to you one humbled and extremely honored physician journey into finding mindfulness for myself, so therefore I can prescribe it to my patients and hopefully throughout our healthcare system. It's a simple mission I have. Basically what it is, it's caring for others starts with caring for myself. And with that, I would like to begin. So, growing up in Jackson Heights, New York City, I was raised in this multitude of cultures and belief systems. And one of the mantras that we have at our door, and I was just there yesterday celebrating Mother's Day, was this one: be the change which you see in the world. And so every day I walked out of the house with this mantra plastered as the last thing I saw when I walked out of my house. And so today, I wanted to introduce to you what I will try not to do, but I tell you what I will be doing. I'm going to be an extreme buzzkill for the first 15 minutes of this conversation, all right? And what I hope to do by the end of it, end on a high note, okay? I'm a simple man. I'm just trying to bring some health and care back into healthcare, and that's about it. So as you know, what I want to talk to you today briefly is to describe this background on sick care. We have a sick care system, and I call it the crisis. And what I want to do is really introduce to you how the impact of this crisis impacts both our patients and our providers. And then hopefully introduce to you mindfulness as an intervention for self-care, and discuss some of the successes and challenges of implementing a mindfulness program throughout a healthcare system. And in fact, just to let everyone know, North Shore LIJ is no longer North Shore LIJ Health System. It's become Northwell Health, and that is where I oversee integrative health and wellness. So let's begin. So what I would like to talk to you about first is discuss this care system that we describe as the crisis. And again, its impact on both our patients and our providers. So you may have seen this slide before. Basically what it comes down to, looking at OECD nations. As you can see, this is from 1980 till 2013, the most up-to-date data. Basically what it comes down to is that we spend the most and yet get the least. As you can see from the previous slide, we spend the most of our GDP on healthcare, but in looking at particular patient health outcomes, like here, life expectancy at birth, so we do not fare as well. We have high rates of infant mortality. We have populations of people that live 65 and older with multiple chronic diseases. So one thing's for sure, if you have a chronic disease, you're more likely to have a second and a third. And those are the leading causes of death in our society today. In fact, 80% of our deaths in America are related to preventable diseases that can be changed through lifestyle changes. And another big problem, and I told you it was going to be a buzzkill in the beginning. So we have this thing called not enough doctors. And there's a multitude of reasons why, but I'd like to share with you 5 of them. Number one, we have this aging population of baby boomers that we just don't simply have the amount of doctors to care for those population. Now with Obamacare or Affordable Care Act, we have an increased amount of access, but yet we don't have enough providers to meet this demand. Third, there's not enough spots in medical school. The number of residency spots and medical spots in our medical schools and our residency program has not grown exponentially to meet this demand. And lastly, the docs in the front end, the primary care physicians. More doctors than ever are choosing specialties and not primary care for a multitude of reasons. And last but not least, and I think what I'd like to spend the next five or six slides talking about, is this thing called physician burnout. So this is a cartoon. A patient walks in. What seems to be the problem, Mrs. Johnson? I feel the way you look. And all this is an extremely funny cartoon. It has deep, deep, deep meaning to me. So this is the real deal. There is an epidemic going on in our nation today, and it's about burnout and suicide statistics. Now, we all hear about we heard about it this morning, faster and cheaper is the way to go. But I would argue there's one industry that probably should not be the mantra, and it should be healthcare. It should be, again, introducing health and care into this healthcare system. Sadly enough, as you see in this slide here, physicians have the highest suicide rate of any profession. So how come you guys haven't heard about it? And I just want to lay out the land here, and this is Malzbeck's classic quote. So burnout is a response to chronic stressors that wear on a person over time. Again, wear on a person over time, not acute ones, such as a big event or a big change. And I can tell you this for sure. As a practicing physician, we are in that front line with our patients. But it's not that one episode of care. It's this chronic stress that really leads to burnout. And in fact, one out of every 2 physicians experience burnout. And this is not just a doctor thing. And this is why I want all my healthcare providers to jump on board here. All healthcare professionals exhibit a high rate of burnout. And in fact, just last year, there was an incredible study out of the Mayo Clinic that showed that roughly every single profession, every single physician in our society, from emergency medicine to neurology to urology, experiences burnout. As you can see here from this statistics, roughly 55% of physicians reported at least one symptom of burnout in 2014. What's scary is that in 2011, we all thought 45, 46% was a problem. And in fact, as you can see here, this is a statistically significant increase in the amount of reported burnout amongst our caregivers in our society. And now you could argue the fact that maybe doctors should know that this is part of their job. This is part of their duty here. But in fact, as you can see in the slide here, the blue line looks at the top is burnout, percentage of burnout. As you can see, it has increased. The yellow line or the orange line is the general working population. So in fact, yes, everyone is stressed out. About 40% of people are stressed out. But here you can see that the number of burnout, again, which is, I believe, one of the biggest problems we have in our society today, physicians lead the way. The bottom slide is satisfied with this work-life balance. Again, you can see that there's been a decrease in this balance of work-life among physicians, but again, an increase in satisfaction with the work-life balance among the general working population. Just some more statistics. 9 out of 10 physicians responded that they indicate an unwillingness to recommend healthcare as a profession to family and friends. Even more dangerous here, I believe, is that nearly 45% of physician respondents contemplate retiring in the next 5 years. So there's been a lot of literature on why. Why are so many physicians burnt out? And now I know the slide to the graph to your right is very compelling, and it's a really interesting story out of Thomas Sowell. He basically tells the fact that we have a healthcare system that is unsustainable, both from the provider point of view and from the financial point of view. As you can see here, just want to highlight here, that red line that's kind of right along the bottom is the amount of physicians that has grown from the 1970s to 2009. Now the yellow is the amount of administrators that oversee this level of physicians. Now you could argue healthcare is expensive, but where's the money going, right? And in fact, the 5 drivers of burnout is flexibility and control. This is the work-life balance. How quickly you work. A friend of mine recently was quoted saying, "I do not care about productivity. I care about patience." It's a very interesting scenario we face today. Work-life integration, workload, meaning and purpose. And again, as I stated in the beginning of my talk, we have this crisis. And I think it's not about money. It's really about meaning and purpose. And now, this Kevin MD, if anyone doesn't know it, it's the voice of the physicians here in the U.S. And I just want to, these are 2 quotes. This is an online .com here. So epidemic of physician burnout. And what I want you guys to take away here, and this feeling that many describe being betrayed by a system, okay? It seems that they're focusing more on the bottom line than with little regard to both the impact of this bottom line to doctors and patients. Most doctors report spending a significant amount of time dealing with the electronic medical record and documentation. In fact, and I will show this at the end here, we have this issue called physician burnout is actually physician abuse. This is somewhat controversial, but I think it's worth noting that many physicians feel trapped in this assembly line, this big box clinics where they're treated like factory workers. The mindset, the picture I get is Lucille Ball on that conveyor belt, okay, on that conveyor belt, trying to put those chocolates in there, okay? Physician burnout is a diagnosis that blames the victim, not the perpetrator. In fact, the term physician burnout is physician abuse. It implies that you are to blame, not the system, and the perpetrators of the mistreatment. One more, told you, buzzkill, I told you. So burnout is a consequence of deprofessionalization, and I think this is the heart of what we're talking about here today. The dichotomy for what we are trained for, which basically comes down to treating the sick, and what we never, ever imagined was basically data entry. For this issue of what the government and our society calls patient-centered purposes. Now, I just want to get a quick hand here. How many people are in healthcare in this? How many people wish they were in healthcare now? And so this is the direct, I think, clash of what we should be doing and how we should be doing it. How does this manifest? Now, you can argue the fact that it's big, so what, who cares? 54% of doctors are unhappy with their job. But I really believe that it actually manifests itself in many, many, many ways. Number one, for physicians and for healthcare providers here, emotional exhaustion, cynicism, hostility, negative self-evaluation, and lack of empathy. Lack of empathy amongst our healthcare providers. Now, how does that relate to the patient? So there are actually clinical implications of burnout. We are more likely to do medical errors. And in fact, if anyone was keeping up with the literature just last week, medical errors is the #3 leading cause of death in America, behind cancer and heart disease. Now, we've been hearing all day today that mindfulness may be a way to bring us more attention and more focus into what we're doing. Adversely affects the doctor-patient relationship, which I believe is a cornerstone of what we're trying to do in medicine. And lastly, but not importantly, to decrease the quality of care. So from a physician point of view, this really has clinical impacts and clinical outcomes that we have to start paying attention to. So like in every world, in every industry, it's the blame game. It's your fault, not mine, and let's work together to come a compromise. But this basically states it all. The take-home message for this first part, the buzzkill of my presentation, is that burnout makes it nearly impossible for individuals to provide compassionate care for our patients. Now, I saw a couple of hands here today that are in the healthcare world. Now, I would argue the flip side, the patients, wouldn't you want your doctor to be compassionate with you? Wouldn't you expect that as the first thing we should be having in healthcare and not so much the bottom line and data-driven? So, is mindfulness the solution for this stress that I just described to you, therefore reducing burnout and therefore improving health outcomes? And now, as a scientist, I will introduce to you some of the science. Now, for me, it's a personal journey. Being a doctor was a personal journey. I had this romantic notion that I would spend as much time with my patients to get them healthier, okay? And I'll talk to you briefly about how I got involved and how I got interested in mindfulness. That's what I call the science and experience. And you've heard from today's presenters is that sitting in a lotus position on a cushion isn't for everyone. And so what I've done in my role in the last 6 years is introduce a multi-pronged approach. Because I firmly believe that we have to find our own way home. Okay? And it may be cooking classes, a research study, yoga classes, a stress reduction program, a rooftop garden, and a mindful minute in the OR. And basically, my goal is really to demonstrate this as self-awareness, so therefore we can provide compassionate care to our patients. So for me, it started here in 1996. So this was a picture of one of my mentors, Herbert Benson. And this was a study that he was looking at Buddhists up in the Himalayas. And what I found fascinating as I was entering medical school, that in fact, by controlling the mind and the body, these monks, draped in cold rags, were able to emanate enough heat to dry those rags on their own. And for me, that was the first time I saw a physician enter this world of what we call today complementary alternative medicine, and trying to give scientific validity to this notion of meditation and mindfulness. And similarly, at the same time, the popular press was exploding. As you saw earlier today, we have this popular press of Time Magazine and Newsweek introducing the healthcare world into mind-body medicine and meditation. For me, so I went up to Boston, to Harvard Medical School, to study integrative medicine with these key leaders. And for me, it was a fascinating time of my life, 2002 to 2006. The good part about it was I was in Boston. The bad part of it, the Boston Red Sox won those World Series throughout those whole years that I was there. So my brother says to me that I broke the curse. But in all seriousness, during that very, very short time, 2002 to 2006, the mind-body explosion of research was happening. And I was right there, right at the front lines. Again, Herbert Benson studying the relaxation response, learning mindfulness stress-based reduction from John Kabat-Zinn, and one of my dear friends and mentors, Ted Kapchuk, understanding of the placebo effects. And last but not least, Sir Richard Davidson, understanding the meditating mind, and Andrew Newberg really putting the meditating mind in an MRI machine. And again, that frontal lobe, I always say to my patients, you just got to lean left a little bit. That left frontal lobe is what you want to activate, and the only way to do that, one of the ways to do that is through meditation. So there I was, a young kid doing a fellowship at Harvard Medical School and learning this whole explosion of science behind meditation. Again, 25 years of history, roughly 20 years now of science of the meditating mind. Then Erica Frank, one of those papers that just kind of blew my mind. And basically what it came down to was that we have to walk our walk and talk our talk as physicians and healthcare providers. And this was a study done out of 2004, basically saying that for MDs, practicing a healthful behavior oneself was the most consistent and powerful predictor of physicians counseling their patients about a related prevention issue. The classic story here was when we put down our cigarettes, so did our patients. When we started wearing helmets, riding our bikes, so did our patients. And that was the kind of model and the aha moment that I had. But then, 1999, Ron Epstein. If anyone is in healthcare, they should understand this seminal article. In 1999, Ron Epstein described what I believe is a true essence of what we call healthcare. Being mindful with our patients. And as you can see here, table 2 are the characteristics of a mindful practice. Now, I would argue to you, sit back, think about for a second the last time you saw a healthcare provider, and did he or she uphold these core values of a mindful practice? Now, I've been married for 20 years. My wife knows immediately when that gone fishing sign goes up on my neck, although I'm looking at her, she knows when I'm not there. And I would argue the fact our patients know instantaneously when we are not there in that room with them. On top of that, we interrupt our patients 18 seconds, 23 seconds into their story. So how are you going to learn the story when you're interrupting and not being mindful? So I want to share with you a little bit of the science in the next couple slides. And if anyone wants these citations, I'll be gladly to give them. I'll put my email at the end. Because this is the science behind what we're trying to do in healthcare. So this was a study looking at the association of an educational program, again, focusing on the frontline physicians, in mindfulness communication. And looking at outcomes from here, you can see here, the intervention was an all-day intensive, 2 hours every 8 weeks. An all-day, 7 hours on a Saturday, and then a maintenance phase for 10 months. Each session consisted of a 15-minute didactic. And again, this is towards physicians. So if you're in healthcare, and as you heard from this afternoon, and I've spoken to Fortune 500 companies, the people want to know the science. And I think just doing the experiential is not enough for a certain population, assuming they understand why we're doing this. And again, we heard about it this morning, neuroplasticity, the connection of gamma waves, the connection of growing parts of our brain through meditation, and a formal way of decreasing our stress and anxiety by tapping into this mindfulness or relaxation response. And what I want to show you here is that there was 15 minutes of actually lectures and then, again, an experiential. And what I want to show you here is that this led to a decrease. Again, baseline pre-intervention, 8 weeks, 12 months, and then 15 months. As you can see, emotional exhaustion, where one of the hallmarks of burnout, decreased. Next slide here. Physician empathy increased. And then this is a mindfulness scale. As you can see, throughout time, and what I like about that slide and that graph is that it was sustainable. This led to another study looking at a brief intervention on job satisfaction and the quality of care and compassion in primary care physicians. Unfortunately, this is not a control study, so we don't have a control group to understand this. But what I want you to take away from this is that their findings suggested that it was a very, very low cost, collegial. And what they did in this study was get a group of doctors together to talk about this. and to experience meditation. And you heard it today, I heard it at least 3 times today, is building groups, building communities to do it together. A time-efficient way to improve well-being and manage burnout symptoms among primary physicians, which has implications to patient care. So now the argument so far that I've described to you is that we're taking care of ourselves. But I would argue that this study actually looked at the hallmark here. How does that relate to patient care? Does the quality of their care increase? And do patients feel better listened to? And this was an interesting study because it was a multi-center study looking at 45 physicians. And it was just not doctors, MDs. It was actually 34 doctors, 9 NPs, and 3 PAs. And the population that we're studying were HIV-infected patients. What was nice about this study is that doctors and the healthcare providers self-rated their mindfulness based on a scale. And then asked the patients, how did you feel that interaction occurred? Were they mindful? Did they listen to you? Some of the key buzzwords. As you can see from the conclusions here, is that clinicians rating themselves as being more mindful in more patient-centered communication and have more satisfied patients. So there's a linear response here. So therefore, if you care for yourself, you're more likely to care for patients. And as I mentioned to you before, you have to find your way home. And the next couple of slides here, and I want to share with you some of these ways. So, you know, a research study that I will be showing with you, again, was mimicking and modeling the interventions. But again, I started realizing that people achieve this either relaxation response or mindfulness through different methods. And just briefly, this is sitting meditation, yoga, cooking classes, mindful eating, gardening, family, music, and nature. And so I started realizing those are the top 8 things how people relaxed. So why not introduce interventions for our healthcare providers that introduce these relaxing moments? So I had an idea. And in 2010, the Wall Street Journal covered this paper. And it was basically teaching healthy ways to doctors in the kitchen. Another epidemic that's happening in today's society, as we all know, there's a huge gap from what our doctors want to be teaching our patients about health and nutrition and what they know. And the only way, again, similar to meditation, the only way to learn about food is to get them out of the classroom and get them into the kitchen. And so for the past 5-6 years, I've been taking a group of 13 doctors, MDs, and we started this program called Fair Wellness. It's wellness through food. And we call them 13 of Graham's dozen. Graham's dozen twice a year for 6 years. And we basically take them out of the kitchen, put a scalpel out of their hand and put a knife into their hand and teach them how to cook. Equally important, I believe that you have to be mindful in cooking and in eating. And so we introduced to them the concept of mindful cooking and mindful eating. As you can see here, these are a group of docs cooking away. You always pair with wine because you should be mindfully drinking as well, and pairing. And so what's fascinating here is we can see in our huge diversity of our doctors in our society today, we bring them into the kitchen at the Natural Gourmet Institute here in New York City, and we introduce to them healthy cooking, always on Monday to support Meatless Monday, right? And we've gone everywhere from Italy to the Mediterranean to Indian food to South American food, and the next class will be Middle Eastern food. Again, trying to tap into what activates patients, changing their behaviors. This led to a research study called the Lenox Chill. So I'm a doctor here up on our Upper East Side at the Lenox Hill Hospital. We started this intervention called the Lenox Chill, and here they are, 13 doctors, again, meditating. And then briefly, I want to introduce this study for you. So the premise is that people who feel out of control, have no autonomy over their job in their workplace, are likely to get stress-related illnesses. What better population to study than medical residents who are at the front line when things go wrong? Obviously, residency is a stressful time. What's really important about this is that stress is a given, but when it starts impacting your health and thus patient's health, that's when you have to start doing something. So really quickly, I wanted to really simply understand the impact of yoga and meditation on residents' stress and well-being, And our goal was help them understand and better identify what their stressors would be. I'm going to briefly go through this really quick. Again, my slides can be available to anyone. What mine is yours, sharing is caring, that whole thing. So this is a simple 4-week intervention. 10 medical residents, both on ambulatory and night float. So we wanted to understand people that had nice lives. Those are typically the doctors that are on ambulatory, outpatient medicine. And then doctors that came right off their night float, which tends to be one of the most stressful, less autonomous, highly volatile points of their rotations. So we got, and you'll see in the pictures, the guys that are in scrubs are the night float, and the guys and gals who are in shirts and ties are the ones who are going onto a clinic. So again, similarly, the session began with a 10-minute didactic on the science of meditation, and then the experiential. As you heard earlier today, that you have to, and I believe you have to introduce many, many ways, many different ways of introducing this relaxation response or meditation. So we introduce them to MBSR, we introduce them to PMR and guided imagery. Interestingly enough, women like guided imagery, the male doctors like the MBSR, just as an anecdote. So this is the weekly content. Again, an overview, the science, and then the experiential. Throughout the times, we did a pre, mid, and post evaluation using a very simple scale because I didn't want to overburden our docs. We used the perceived stress scale. As you can see here, they didn't change their clothes. We did mostly chair yoga and certain asanas and yoga postures that really were not intensive enough to build up a sweat. And then again, we used perceived stress scale. And again, we wanted to understand baseline, mid, and post. So this is a perceived stress scale. And I just want to highlight number 9 here. In the last month, how often have you been angered because of things that were outside of your control? Now, that is medicine. That is healthcare, right? It's a very simple day. When you look on that calendar and you see 15 patients, you kind of get to know who they are, and then you can actually approach your day. It's when things fall apart. That's when the stress alarm goes off. So, I wish there was significance, on the mean score. But actually, that score, remember that number 9 question, we showed highly statistical significance in a very short time, in 4 weeks, for residents to better control their anger when things get out of their control. And for us, that was a really successful subgroup analysis. And I think what it indicated that there is a role for yoga and meditation to help residents cope with stress. But obviously, more research is needed to better understand their overall wellness. So what this led to, in the next couple of slides, I want to introduce you what this led to. So every year, on their first day of internship, this is a group of docs that are meditating. Interestingly enough, there's a couple of them there. You can see them. That guy over there is not smiling. That one's not looking. As an ex-program director, the ones that were not looking, there's 3 of them that are not engaged here. All 3 had problems in their training. Now, that is completely anecdotal. That's a very small N. But interestingly enough, out of a group of 33 residents, 3 of them that were not engaged, all of them had disciplinary actions that, unfortunately, they had to go through their training with. So that led to what we call rooftop yoga. So in New York City, space is really hard to find, right? And you'll be hearing no's. There's no room. We can't give that room up. So we ended up growing up and going up and finding empty rooftops. And this was a class that we still continue doing called rooftop yoga. This led to a wider movement called stress management workshop, where we do visualization, guided imagery, relaxation techniques. Now it occurs every last Tuesday of every month. The piece of resistance that I cannot wait to talk to you about is this. So this is an abandoned, barren rooftop. So this was a rooftop when I was in training in 2001 to 2002. We used to go out there, and some of our colleagues used to smoke and sunbathe out there. When the smoking ban came into New York City, what they did was basically lock the doors. Right? That's what they did. So for 8 years, this is what it looked like. And over the past 3 years, we turned that into this. So it's the first ever edible, educational, meditative garden on a rooftop in New York City. And so let me bring you in. So again, this is an average morning. We use raised beds here. Everything we grow here is organic, sustainable, comes from Long Island, local. And this is an average day where people just hang out. In fact, the biggest problem we have is that we don't have enough garbage cans on a sunny day, because people don't go into the cafeteria, instead come out into the garden. This is me meditating, mindfully watering my plants on the weekends. And everything we grow, again, is organic and sustainable. And that's me right there with our 2-foot Swiss chard. And we've actually introduced this concept. Oh, this was my wife's bright idea. We're bringing rocking chairs. And one of my favorite things to see is one of our healthcare workers just rocking away and falling asleep outside. And we have actually introduced wellness rounds now. My colleagues tells me it's a lot easier to give bad news or bad feedback to docs when they're outside. So if you are actually in that position that you have to give feedback, do it outside. It's less harmful. Oh, and one more thing I want to do here is that, so right here. So basically what we've done is collaborate with our kitchen. And we started this movement called Rooftop to Bedside. So we're actually bringing the fruits of our labor from our rooftop into our kitchen and then into our patient rooms, changing this notion of hospital food. Last but not least, 20,000 people visited Victory Greens last year. 20,000 people visited our garden last year.
We're going to take a brief moment from the stress of our day. We're going to close our eyes, focus just on this moment in time. The mindful moment is an opportunity for surgeons, nurses, technicians to live moment to moment without the stress of reflection on memory or looking and fearing the future, but really being in tune with yourself, being in tune with your breathing as a way to generate calm.
That's John Bookvar, who's one of our neurosurgeons, and actually introduced a mindful minute into his OR. And every day, when he goes into the operating, he just gathers his group of techs and nurses and just centers themselves for a minute, and therefore introducing that kind of idea into the OR. And cardiology now has accepted it. Anesthesiology says to patients, have you tapped into that relaxation response? And what we hope to be doing the next year is introducing guided imagery, pedicholostats, great work preparing for surgery, into every single OR time that we have. I just want to wrap up in the next 6 minutes here, just stating the fact that this is just not about us. This is about how do we translate this knowledge into better patient care. 75% of doctor visits are a result of a stress-related illness. As you can see, the inverse 31% of people with high stress never discuss stress management with their physicians. Now, I can blame my colleagues, but again, we're not taught this. There's huge gaps in nutrition education. There's huge gaps in exercise education and huge gaps in stress management education in our medical training. And so our friends up in Boston published a study looking, again, doctor's orders, 20 minutes of meditation twice a day. This led me to start prescribing meditation and hatha yoga in 2014. So these are what we used to call prescriptions, right? These are kind of antiquated now. There's no such thing as prescriptions anymore. There's actually EMRs, and we haven't been able to get this into an EMR just yet. And there's something powerful about giving a patient a prescription, like meditation. Again, you heard earlier, you start 5 minutes twice a day, BID means twice a day, and then you work up to 20 minutes 4 times a day, BID, follow up with me within 4 weeks, and your refills are for life. And so, again, our dear friends Herbert Benson just recently published a paper looking at the use of relaxation response, people that entered his program up at the Henry Benson Institute, and what was the impact of that into cost. Because ultimately, our CFOs in our hospitals want to know, how does this affect the bottom line? Not how do you make better doctors or better patients or happier patients. It's really how does this affect the bottom line. As you can see here, out of a study, and again, I can share with you everything I have here, an average 43% reduction in billable encounters, translating to an average of cost reduction of roughly $2,400 patient dollars per year. So this is just not good for your health, it's also good for the bottom line. That's mindfulness so far. My last part is this, change. This is the classic change equation. And I wanted to discuss with you some of the challenges of implementing a mindfulness program in healthcare. So I believe I've shared with you this dissatisfaction. Was the buzzkill, okay? I hope I've shared with you my vision for a positive future state and the first steps I have taken in this vision. Now, that only works, right, if it's greater than the resistance. Now, if any of these are zero, resistance will always win. So therefore, you have to not have zero here when you're making a change. So I will share with you, first they will ignore you, then they will laugh at you, then they will fight you, and then you win. So some of the challenges, resiliency. You got to be tough, okay? And I apologize to all of you that healthcare has now only got into this world of meditation and mindfulness. And every time I come to these meetings, I'm always blown away by the fact that Google is leading in meditation, you know? And it should be us. It should be our doctors. It should be a healthcare, you know? You have to be comfortable with hearing no. There will be tons of no's, okay? Sustainability, this is a big point. Time and money, we heard it all today, is that you have to find the right time, and it won't be the right time. You know, nurses and administrators work completely different hours. Doctors work different hours. So we started this program trying to do an 8 a.m., a 12 a.m., a 12 p.m., and an 11 p.m. meditation course or yoga course. And again, it's just not sustainable because then you have to first find and then pay teachers and educators who are willing and able to work with this population. You have to get buy-in from up, okay? Administrators, doctors, and nurses. I always tell my doctors and nurses, you can't get down. You can't get downward dog down. You can't get downward dog if you don't understand what downward dog means, okay? Research is difficult, but not impossible, and I've shared with you some of the actual research out there. So my key points for you guys to take home with you is, sadly, there's been little emphasis placed on clinician well-being, and just now, institutions are beginning to recognize the impact of burnout on patient care and institutional expenses. Something that came out earlier, which I thought was fascinating, is that there's a direct relationship between well-being and turnover. And I thought that was a fascinating actual thesis. In an era where physicians suffer professional burnout, a mindful practice may be the way for them not only to heal themselves, but heal their patients. Now, this is something that this is no joke here, but I really want to focus on this, is that we cannot meditate out of a bad situation, okay? You cannot take enough deep breaths to end your work abuse. I believe that doctors must demand and advocate for a working environment that supports and nurtures the doctor-patient relationship. What you must do if you're feeling abused is to leave your abuser. And if you need help with the escape route, you call me. And with that, I'd like to introduce to you my fresh model of healthcare, which focuses on food, relaxation, exercise, sleep, and happiness. And my tagline is, go to health. So if you're willing to come with me, I'm coming out. I'm actually leaving my current role as the Director of Integrative Health at Northwell to start my own thing, because I believe change happens quicker if you can show it on your own, and then what will happen? Healthcare institutions will buy it. So if you don't believe me, believe this guy.
Do you feel alive?
I feel happy of myself.
I feel happy of yourself too. What do you got, any words of wisdom? What about for all the other kids trying to learn how to ride their bike? Can you say anything to them?
Everybody, I know you can believe in yourself. If you believe in yourself, you will know how to ride a bike. If you don't, you just keep practicing. You won't get the hang of it, I know it. If you keep practicing, you will get the hang of it, and then you can get better and better at it as you do it.
Give me some thumbs up.
Thumbs up, everybody!
All right.
Bye.
So last but not least, this is my prescription. So if you haven't tried it, give it a try. It will take practice, but you will be rewarded with greater sense of well-being, purpose, and meaning, what we've been losing in medicine in the last 15 years. Thank you so much for your attention. Any questions? Yeah. Oh, Mark.
Thank you. I'm really glad you showed that last quote about, being engaged mindfulness, right? Seeking action or right action in the face of social injustice. It makes me think that the PSS, the question that I don't like in it was the question that was problematic, which is, how many times have you been angered? Maybe we don't want people not to be angered, right? Maybe we want people to be mindfully angry and then responsive in a mindful way, just so that's an editorial comment. The question I have is, I know how hard it is to put anything into the curriculum for medical students.
Yeah.
Is anybody doing that? Is anybody trying to, are there any, leading medical schools that are teaching mindfulness in some ways to their...
Yeah, so I'm very fortunate to have a new home in the American College of Lifestyle Medicine, where again, obviously this is a mindfulness conference, but again, the pillars of, I think, health and well-being are lifestyle, right? And Eddie Phillips up in Boston is leading the curricula in mindfulness. University of Minnesota as well. They're probably the two biggest institutions leading the change in medical school curricula to introduce more mindfulness training to our young docs. Sorry, I'll be around.
Thank you so much. You absolutely did kill my buzz, and then you healed it.
So rock and roll.
Thank you for everything you're doing for healthcare workers in New York, and thank you for sharing it with us.
Oh, thank you.
It's fantastic. I really
pleasure.
appreciate it.
My pleasure.
Thank you.